Thank you so much for taking out time. You're here for your work in Pune, but this autism, I think last time we discussed, it was 26th of Jan, and we thought we should speak about autism. For our audience, could you please just quickly tell us, Dr. Ashwani, what all you are doing? We talked about diabetes and reversal of diabetes last time. I'm aware about the functional medicine awareness work that you are doing. But quickly, where all your clinics are there, what all work you're doing, if we can start there, that will be really helpful.
Sure. Thank you so much, Dr. Smita, for taking out time and creating this awareness. So primarily, we work with patients who has been sick for quite some time, and most of them sort of given up by the system, says this problem will stay with you for life and nothing can be done. And
all the chronic diseases.
Most of the chronic diseases, and it's painful to see their pain.
Yeah.
And sometimes things are easy peasy. Easily we can fix it, but then people went behind the diagnosis, people went behind the big names of the disease, but nobody's looking at what is the problem. So this is where to find out what is the problem leading to a diagnosis where we work. Now, primarily autoimmune issues like psoriasis, rheumatoid, metabolic disorders, and a large part of our work is into brain disorders, and one of them is autism, ADHD, a little bit of a Parkinsonism and schizophrenia, a little bit of, not much, but largely into children we work with autism, ADHD cases.
Okay. I feel that large awareness started happening regarding autism when Tare Zameen Par, was there, and My Name is Khan came up. So Asperger's syndrome and autism related, people started talking. Is it because that autism is more now? Is it because we are able to diagnose it? Or we are able to identify, or is it seriously increasing, the prevalence is increasing, or is it something that we are doing wrong, that disease is more prevalent now? So what's your take on that?
So if you look at the data is scary. Probably 40 years back, hardly we would find, in our schools, in colleges or in our buildings, we would hardly have any child, out of thousands would have one.
Correct.
But if you look at now, India, we don't have good data, but US data, 1 in 30.
Okay.
1 in 30 is having either autism or some characteristics of autistic features. So almost, it's a very, very high prevalence. So it cannot be that we have been diagnosing it. If a child would have a problem, you and me, our parents would observe. But in the last 20 years, the problem prevalence is increased dramatically.
Okay.
And there are reasons behind it. So it's not just diagnosis.
Okay.
It's a serious problem.
It's a serious problem. We should, we should be focusing. And one important thing which I feel that for HealthCommune, when we talked about autism, I feel at least in the major cities, there is some awareness. Parents are able to see that, okay, their child is slightly different, behaving different, or there are something that they need to see comparison with the siblings. But I come from tier 3 city. I'm sure that my mother will be like, okay, she's just lazy, or she doesn't want to study, or she's just distracted. Especially girls, it's very tough for girls. And I think that's also a data that I was reading, that more boys we are able to still diagnose, but girls are able to mask their symptoms. So we are not able to diagnose girls with learning disabilities.
Right. So I think at least the kind of patients I work with, there's no way somebody can miss them.
Okay.
The amount of severity, they cannot go undiagnosed.
Okay.
Only challenge that I see is if a parent, and many of the parents that work with us, they work from the small places also. Remote places of India. And these are basic families. Only challenge that I see when they go see a doctor, or a development pediatrician or a therapist, etc. Most of the time they are given an answer. Nothing major can be done. That's a problem for life. It is going to be there for some time. And with that kind of attitude from a healthcare professionals or healthcare system, then how much work you can do about it? See, if I tell you this, something we can do, some work we can do to resolve some of the symptoms or make them better or bring them out of the problem, then a parent is willing and committed and putting efforts towards it.
Correct.
If they go see a doctor and somebody's telling nothing can be done, then they sort of lost the hope and then...
Correct. And once the doctor will say, nobody will question again.
Nobody will question.
Especially in India, Bhagwan ne bol diya, that's the problem we face.